Sinusitis is inflammation or swelling in the lining of the air spaces between the bones of the face. When those cavities get swollen, they no longer ventilate or drain properly and can get infected, and that infection can cause pain in the face. Sinusitis is the most commonly reported chronic medical condition in the United States, and it's the fifth most common reason for someone to get antibiotics. Sinusitis can occur in any age group. It can happen to anybody. There are some people, however, that are more prone to sinusitis. Any inflammation in the nasal cavity or the sinus cavity can lead to an infection. People who are more prone to sinusitis include people with allergies, recurrent upper respiratory illnesses such as colds, or reflux. There are certain medical conditions also that can make you more prone to sinusitis, such as cystic fibrosis or tobacco abuse. Abnormal anatomy in the nasal cavity or sinus cavity, such as nasal polyps or deviated nasal septum, can also lead to sinusitis. The symptoms of sinusitis are very similar to the symptoms of a common cold. They include mid-face pain or pressure, nasal congestion, thick drainage from the nasal cavity or postnasal drainage, headaches, and sometimes fevers. If symptoms persist for greater than 10 days, it's not likely a common cold, but more likely sinusitis, and you should seek the attention of an ENT physician. People will often use over-the-counter medications to treat their symptoms of sinusitis, and even though that this can reduce the severity of the symptoms, it's never been proven to cure or to reduce the duration of the symptoms. There are some problems with over-the-counter medications, such as topical nasal decongestants. They can cause a chronic rebound of nasal obstruction. They can cause a perforation of the septum, and you can actually get addicted to that medication. If inadequately treated, sinusitis can have rare but very serious complications, such as brain abscess, orbital abscess, or meningitis. If symptoms of sinusitis are very recurrent, or if treatment of sinusitis doesn't result in cure, or if you have complications from sinusitis, you should seek the attention of an ENT physician. When you see an ENT physician, they will perform a complete head and neck examination. An ENT physician has special instrumentation to evaluate the inside of the nasal cavity to look for deviations of the septum or polyps or abnormal anatomy. Also, if pus is noted in the nose, it can be cultured and sent for analysis. If there's any question about the diagnosis, a CT scan can be performed, which can give you further information regarding the anatomy of the sinuses. If you have recurrent sinus symptoms, if your symptoms do not resolve after adequate treatment, or if you have complications of sinusitis, surgery would be considered at that point. At Charleston ENT, we have the latest technology for the diagnosis and treatment of sinusitis. We have the latest in image guidance for sinus surgery, so your surgery will be more complete and safer.